My name is Stephanie. I'm a physical therapist and the owner of House of Physical Therapy. The office is based out of New York City, and we've been around for about 3 years now, but I've been practicing for close to 6. Our target are athletes and fitness instructors very specifically. So we have former athletes who are now post-college who are still playing their favorite sport, but maybe not necessarily conditioning at the same level that they were in high school and college. So that is definitely one piece of our demographic. And the other piece are the runners and fitness enthusiasts, people who are taking spin classes or going to the gym 5-6 days a week, and some overuse injuries develop or different things come up. So we are very much in the athletic population. And right now I'm actually in Florida and I'm treating some of my patients remote. And we have 2 therapists in the office in New York City that are continuing to treat in person. So a little bit of a shift. Okay. And I know that your interest, based on the poll of everyone who's attending today, is to really learn more about tendons, ligaments, and the specific topic of shin splints. So I broke down the presentation into 5 parts. First, we're going to talk about the difference between a tendon and a ligament, go into a little bit more detail about tendons, what they do for us, and how you can keep them healthy. And then we'll get into your specific interest of shin splints and what you can do to prevent them. I have questions throughout the way, so I'm hoping that you guys can be active and participate with me. But of course, there's time for questions at the end. So first up, tendons and ligaments are both elastic material that have very similar makeup, and they contribute to the motion of our joints. They are composed of collagen, and their strength is due to the size of those collagen fibrils and how they develop as you are growing up through adolescence, and then also based off of our training. So exercise plays a very important role in the strength and composition of our tendons and ligaments. So if they're made of the same material, what is the difference between a tendon and a ligament? And when I say the same, very similar structure. So does anyone want to pop in either in the chat or unmute themselves for a minute and give me a good guess? I will tell you that I asked my family members this beforehand because I wanted to just get a gauge of what the background was, and no one got it right. So
I'm pretty sure tendon is attach the muscles to the bone and how you can move the muscle. And then ligament is how you move your bones. Am I correct?
Beautiful. That is
Perfect.
spot on. So your tendon connects the actual muscle belly to the bone, where the ligament is deep inside and that connects bone to bone. I know the last presentation, I peeked at it a little bit and they talked a lot about the ACL. So your ACL is ligament, right? And that's deep inside your knee joint, and that limits the motion between your thigh bone and your shin bone. So since you've already had a little bit of background on ligaments last session, I decided to focus more on tendons and how you can keep them healthy. So tendon goes from muscle to bone, made up of collagen type 1 fibrils and something called proteoglycan. Collagen is responsible for the stiffness of the tendon, and proteoglycan is responsible for the elasticity, so how much it stretches. So that specific composition, how much of each one, tells you how stiff that tendon is or how flexible it might be. There are 2 tendons for every muscle. So we name them by their location. The origin, so if you think about where your bicep starts, it's going to go from the bone into the muscle. So we call that one the musculotendinous junction, named by where it connects. The second one is where the muscle connects to the distal bone, and that one we call the osteotendinous junction. Osteo means bone, musculo means muscle. So it's basically the origin and the insertion. So it's two tendons, every muscle in your body. Those tendons are responsible for mitigating forces. So when you push something, right, you are contracting your muscle, and that force is going into the tendon and causing your joint to move. Same thing when you absorb forces back into your body. Whatever force is coming from the ground or what you're lifting needs to go through the tendon and controlled before it gets into your muscle. If we didn't have that force absorption, a lot of wear and tear would happen on our joints. Okay. So you can think of your tendon as the middleman of regulating forces. Okay. I would love it if everyone could stand up and try and just jump. And if someone could tell me what they did to prepare for that jump and how they got off the ground. Okay, so I saw a couple people jump. What was the first thing that you did? Let's see, can I call on someone?
Yeah, for sure. Jerry's raising his hand.
I can't see the names. Let's see. So I see someone with New York City skyline, and I saw you jumping. So
That's Thomas, I think.
Oh, okay.
All right. So what did you do to prepare for the jump?
I bend my knees and push with my feet and my toes. Yeah.
Exactly. And then when you came back down, did you land with your knees locked out?
No, I landed with bent, so that there has a cushion, kind of.
Exactly, so that you have a little bit of a cushion. So thank you for volunteering. Basically, what I wanted to get out of that demonstration is that your tendons are like springs that are absorbing that force. You would never stand up and jump like this. Right? That goes directly into your knees and hips, could be painful. You want to really absorb and allow your muscles and tendons to take up that force, not your joints. Okay. If we get into a little bit more detail about the different types of tendons, I told you that there's two tendons for every muscle in the body. Well, all of your muscles throughout your body are different shape and size. So that means that based off of the location and the job of that muscle, the tendons are going to be oriented a little bit different, and their composition is going to be a little bit different. So some muscles, like your bicep, are going to resist an easy straight plane back and forth movement. There's some rotation in there, but we won't get into the detail. Other muscles like your hamstrings, if we go back to your ACL lecture, your hamstrings act to control rotation of your shin. So if you think about your hamstrings, just take your hands and push on the back of your thigh, right? As they come down behind your knee, they turn into a long skinny tendon, and that controls how your shin rotates. If you don't have strong hamstrings to control that force, a lot of the force gets transmitted into your ligaments. And now that can lead to injury down the road. A major focus when we talk about ACL rehab is strengthening the hamstrings, specifically to control that rotational component at your shin and to control the deceleration. So if you imagine running and you're taking a really long step, the hamstrings are going to slow your leg down as you hit the ground. If we don't have good control there, it's going right into your knee joint and stressing the other ligaments like your ACL, PCL, MCL, and LCL, right? As you get older, or as you put a lot of stress on your body, the tendons can become smaller. Now, if they shrink in diameter, then that relates to how well they can absorb or transmit forces. So technically, as that tendon degrades a little bit or gets smaller, it affects the strength of your muscle. Good news is we can prevent that from happening by doing very targeted exercise to keep the tendons healthy. And when I say targeted, I mean slow and controlled. If they're responsible for power and force, or things like running, right? So giving you that power to push off the ground and absorb the force as you land, we want to do slow, controlled exercise to make sure those tendons are staying healthy and continuing to keep their size or even growing and not breaking down from all the wear and tear. Blood flow to the tendons is very important in the healing process, and that's why we have redundancy. So redundancy means that there are multiple pathways to accomplish the same goal. So the blood flow is not just in the intrinsic source of your two junctions, right? So the musculotendinous junction and the osteotendinous junction. You have their own blood supply there, but you also have an external source of blood flow from what we call the paratenon or synovial sheath, and that is the covering around. Okay, so double redundancy there to make sure that we're hitting that goal and keeping the blood flow going to the tendon for healing. Okay, I want you to reach down and feel the back of your ankle. Everyone knows Achilles heel, right? We've heard that term before. So the Achilles tendon is one of the biggest biggest tendons, and has a very specific characteristic if you compare it to the muscle that it attaches to, which is your calf. So if you squeeze the very, very bottom where it attaches to your heel, you can feel that it's maybe long and skinny or a little bit more firm, versus if you squeeze right below your knee, it's soft and almost supple in comparison. If you point your toe down, that muscle is going to tense up, and you can really feel how that will stiffen the tendon that attaches to your foot. Okay, different types of injuries that can occur to the tendon. We name them based off of what is going on underneath, or the pathology. And that is very important when it comes to how to recover from the injury. If we don't know what the source of the issue is, and we just give a blanket, you should rest, we may not get good results. So very simple, if we just look at the endings, apathy is a fancy way of saying pain. It comes from the Greek word for disorder. So if someone says, I have tendinopathy, all they're saying is, I have pain in my tendon. We call that an umbrella term. And then we get into the more specific, what's actually going on. So tendonitis, the term itis refers to acute pain, acute meaning sudden, so very recent, and that pain is due to inflammation. So if we think of our typical overuse injury, right, you're doing something repetitive that's causing stress, that would be inflammation in the tendon that is of sudden onset within the last few days or last week or so. That's going to respond very well to resting, right? Overuse, we did a little bit too much, now we're inflamed. You want to rest it, ice it, and treat it that way. If it is actually a tendinosis, the ending osis is meant to diagnose something that is not of inflammation. So not caused by inflammation, but caused by degeneration of the tendon. So a true breakdown from overuse. If we think about the timing, something that you've been doing for a couple weeks can cause that acute pain. And if you do not acknowledge it and you continue to train through it, or it doesn't get diagnosed, then we can get into the breakdown of the tendon even after the inflammation is gone and we're no longer in that new stage. At this point, it's not going to respond to rest and ice because there's no inflammation. So there's something else going on that is causing this pain. Okay. Typically, tendinosis affects people who are participating in very high intensity activities or sports. So runners, we'll get into the next slide more specifically, but runners, dancers, and military recruits are very, very common to develop tendinosis because you're doing a high intensity with very little breaks and maybe not doing any cross training or other things to support that demand. When we talk about a tendon rupture, this is when we get into tears. So there can be a partial tear, which means that only a small section is affected, or there can be a complete tear, which is a true rupture. Okay. If everyone is comfortable, I was going to show you an example of a tendon rupture. If you're not comfortable seeing the video, stop me now. Okay. So let's see, you can still see my screen, correct?
Yeah.
Okay. So no, and there's an ad. So this is someone who's doing a jumping or bouncing style exercise, very fast, using lots of momentum.
Oh shit. Oh shit.
I hope that didn't terrify anyone, but the purpose of me showing you that is an Achilles rupture is extremely obvious to identify and not something that you should necessarily be scared of occurring, because it is when you are doing a high intensity sport or using lots of momentum and no control, and you don't have the complementary strength training or health to support the activity that you're doing. So not to pick on this woman, but she had a couple risk factors, and that gunshot sound was the Achilles tearing. Okay. This is another example of a tendon rupture. Again, very, very obvious and not so common. This happens most often in bodybuilders, and I actually used to work in a gym that had about 20 to 25 personal trainers of all different backgrounds. And there were a couple traditional bodybuilders that came to this gym, and I have actually seen this live and diagnosed it on site. What happens is you're doing something like a pull-up or a bicep curl, very, very heavy, and your muscle is strong enough to do the work, but there's no complement of slow and controlled exercise to allow your tendons to accommodate for those forces. So doing something very heavy, very fast, and what happens is called a Popeye, or the bicep actually rolls up into the arm. Good news is an injury like this, they usually don't really do anything about it because you have other muscles that bend your elbow and lift your arm. So unfortunately, it's more cosmetic, and they won't really fix this unless the person has a problem with function. Again, these two types of complete ruptures are only painful at the instant that it happens, because when you completely tear a tendon, the nerves are no longer connected, so you're not getting that immediate pain. It's much more painful if you have a partial tear or if you have some sort of overuse. Any questions on this? Okay, so the third part of our presentation is talking about specifically shin splints. Shin splints are an umbrella term to refer to pain on your shin bone. We call it medial tibial stress syndrome. Your tibia is your shin bone, medial is the inside. Usually the pain occurs on the inside of your shin bone, and it happens from prolonged stress. That's why we name it like that. Here are some examples of where you can feel pain. It would either be right on the front of the shin, directly under the knee or slightly medial. Or along the inside, if you feel your ankle bone, it would be about 2 to 6 inches above that, between where the meaty part of the muscle and the shin is. It's usually a very specific area of pain and develops over time. Not something that happens overnight. All of a sudden you wake up with shin splints. Usually it's progressive, where you only notice it if you're doing something like jumping, running, something high intense. And then eventually, if it's untreated, you start to notice it when you're walking around or even at rest. The muscles involved here are tibialis anterior, tibialis posterior. Anterior means front, so we're looking at the front of the shin, and you can even feel if you go right below your knee and you move your foot up and down, that muscle will puff up. That's your tibialis anterior. And your tibialis posterior is deep to the big calf muscle, so you can't really feel it so well. Okay. I think I mentioned earlier, most common, we see shin splints in high impact athletes, very common in runners, dancers, and military recruits. Most often, there has been a recent change in training routine. It's very uncommon to develop shin splints when you've been doing the same thing repetitively and consistently. It's usually when there's some sudden change. Can anyone think about why a military recruit would be very likely to develop shin splints? Want to jump in?
Do they have like time requirements to finish
Anything, so they kind of do it really fast. You know, certain shorter period of time with greater force. Kind of, that's a greater impulse and kind of more likely to have shin split.
I like that train of thought. That's definitely one factor.
I also,
Yeah, go ahead.
sorry, I thought maybe because they do like a lot of high intensity like workouts and like there's a lot of like change. They go from like one thing to like another all the time.
Absolutely. Super high physical demand. Think about their uniform and think about what you work out in. So military recruits are running and doing all of this high demand training in heavy boots. So it's really common that they get these shin splints from flexing their foot or hitting the ground in these heavy boots, right? We wear sneakers or proper footwear when we're running or doing these other activities.
So question, so these heavy boots doesn't absorb their like their force, or is that why it's easy for them to like rupture? There's no cushion to like stop their movement?
Yes, so the boots are gonna give you some cushion at the foot, but it's much more stress. It's almost like you're running with weights on your ankles. And not even on your ankles, but on your toes. So every time you go to swing through, your ankle isn't free, you're pulling on that heavy boot.
I
So
see.
it's more about the weight of it than the absorption.
Got it.
Okay. The underlying cause of shin splints can be a variety of things. We know tendinopathy means pain in the tendons. So if we're talking about those military recruits, we're talking about overuse of that anterior shin muscle and pain along that anterior tendon. Periostitis is a fancy way of saying inflammation in the surrounding bone. So the periosteum is the outer layer of the bone. Periosteal remodeling, similar idea, right? There's tons of stress and not enough time for that stress to be taken in and accommodated for. Stress reaction at the tibia, so overuse, and dysfunction of those muscles that I showed you before. The soleus muscle is the deepest of your calf muscles. So if you think about your gastroc, that's the big, thick calf muscle, and then the soleus sits directly underneath it and attaches to your Achilles tendon. So you can kind of think of that as a unit. The last portion is talking about how to prevent them, and how to know if you're at risk. If we say that shin splints develop when there's a sudden change in routine, this puts beginner runners at risk. You're going from not doing the activity at all to jumping into a new form of exercise. So beginner runners have to be mindful of their volume and making sure that they're going slow enough as they ramp up their mileage to allow their body to adapt to these new forces. Experienced runners who do a lot of hills or uneven terrain, even running on concrete, we know can be a risk, specifically because of the force absorption. Concrete does not have any give like a track would, or cross-country running where you're running on dirt and grass. Footwear is super important. We talked a little bit about the boots. You want to be running in proper shoes. If your shoes are worn down or not properly fit for your foot, then that can be a contributor. That's usually the most easy to fix. Training errors are definitely the number one, especially in my patients. We always go back and look at, what do you do outside of the activity that's causing pain? Are you ramping up too quickly? Are you doing enough rest? Are you monitoring your volume, right? Usually it's the situation of too much, too fast. Easy ways to prevent it: listen to your body. If you are doing something that involves plyometrics, so jumping, or your ladder drills in your warm-ups, you really want to pay attention to your contacts, how many times your foot hits the ground, how many times are you jumping in this workout. And you don't want to do those things 2 days back to back. So for example, a HIIT workout. I don't know if anyone likes to go to those style classes or watch those videos, but something that has a lot of box jumps or squat jumps. If you do something like that 2 days back to back on a regular basis, you're going to be stressing your body before you've allowed it to adapt to the exercise. That relates to overtraining, right? And the recommendation for footwear, especially for runners, is to change shoes every 250 to 500 miles. I know it's not possible for everyone. I've had this conversation with a lot of my patients. It may not be possible to have 2 pairs of running shoes. That's kind of the best practice, because then you're always alternating and you're always making sure that you're not wearing down until that last little bit, right? You always have that option to swap out your shoes, and then after a good 250 miles, assess, is it time to get another pair, and rotate in. Cross training is a huge one. I see people who are doing the same sport all 4 seasons and never doing anything complementary. This is usually biggest with my runners. I have an ultra marathon runner that I've worked with for years, and it took a very long time to convince her that running is not the only way to get better at running. We also need to move our bodies in different directions and make sure that you're getting different forces coming in to avoid that wear and tear of the same motion over and over again. And strength training is a really big one. Every sport should involve strength training in their program. When we're talking about off season, I would do something like a periodization for my patients that are getting ready for their sport. If you're in season, then you should still have 1 to 2 days of specific strength training where you're lifting heavy, slow, and controlled. So in summary, the 4 topics that we covered: tendon versus ligament. Tendon is muscle to bone, ligament is bone to bone. And an easy way to remember it is to think about your ACL. L stands for ligament. That's kind of your trick to remember it. Tendon is responsible for absorbing forces. It's a nice short and sweet way of thinking about it. Your shin splints are an overuse stress syndrome that can be prevented by cross training and having a clear plan how to scale your training and not going too fast. Does anyone have any questions for me?
Jared, you can go ahead first.
Hi. So in terms of preventing like shin splints, as a track and field athlete myself, does hydration or diet have any way to help prevent shin splints by any chance?
So nutrition is a huge factor when we're talking about muscle health and your training. Of course, you want to be properly hydrated before your sport. As far as a direct correlation to preventing shin splints, I'm not positive. I would say that if this is something that is happening chronically, then there could be some underlying reason why you wouldn't be fully recovering from those that stress, right? You're stressing and again, shin splints are an umbrella term for a ton of different things that could be causing it. But we'll say the typical true shin splint is an inflammation of the bone. So if this is happening repetitively, then maybe there is something in the diet that's missing that you're not getting the ability to recover. I always look at it from the physical standpoint because that's my scope, and I always look at the training. So are you allowing yourself to strength train to the level of the sport that you're trying to do or the distance you're trying to run?
Thank you.
You're welcome.
I have a question. So you going back, it was 2 tendons for every muscle, right? Every muscle had 2 tendons attached to it. What was the 2 again? It was MTJ and OTJ. Is that right?
Correct. And we name them by where they connect. So if you think about your bicep, that's an easy one to imagine.
Yeah.
Yeah. MTJ is the musculotendinous junction. I'm sorry,
Okay.
musculotendinous junction. And then
Yeah.
OTJ is the muscle to the bone, so osteotendinous.
Oh, I see.
Okay, so you have that origin where it's coming from the bone to the muscle, and then you have the insertion where it's going from the muscle into the bone.
Got it. Thank you.
Yeah. Anything else?
When it comes to tendons and such and recurring injuries, is it more possible to get a recurring injury when say you need a shin splint and such, or is it just the same chance?
That depends on how you recover. So if you take the time to recover and identify the true origin or the true cause of the shin splints, then you have a much better chance of not having them in the future. I have seen it where it becomes a repetitive or a chronic issue when we're not going up the chain and addressing other weaknesses. So a huge one with runners is glute and core strength. And if you don't have the stability in the bigger muscles up the chain, then a lot of the force goes onto the smaller muscles, right? You saw how skinny that tendon was in the front of your shin. So if that tendon is absorbing all of the forces from your running or jumping, and you're not getting any proper absorption into your big muscles like your hamstrings, your glutes, your core, then you can have that repetitive injury. Usually we do a full body physical exam to make sure that we're addressing any other weaknesses. I don't specifically do running analysis in the office anymore. My office is very, very tiny, but that's always something that can be helpful if you have access to a running store or a physical therapist close by that has the running analysis. And then you can see, is there something that we're not identifying?
One more thing, I guess. I used to have tendonitis in my left wrist from golf, and I guess how closely related is that to the things we talked about today? Like it's more like an inflammation of the tendon and the link to my fingers, but
Right? So if we talk about golfer's elbow, we call it medial epicondylitis, or if you're talking about wrist tendonitis, then we're talking about where the muscle inserts down at the wrist and hand. So if you're getting that pain from the sport and it's going away when you're at rest, or it goes away if you take Advil, Motrin, something like that. It goes away if you put ice on it. But then the next weekend when you go out to golf, that pain returns. Then we're talking about an inflammatory process where you have this specific movement pattern that's causing an overuse of the wrist tendons, so the wrist flexors. As far as how it relates to what we talked about today, it's absolutely exactly spot on, where I would take that golfer, you, and do a physical exam and see, is there something going on at your shoulder, at your trunk, at your elbow? What else is happening up the chain that is causing your wrist to take all of the stress as you're hitting the ball or as you're moving the club? Is there some limitation in your rotation as you're going through the swing? Is there some limitation in your shoulder as you're coming up into the backswing that's causing you to flex your wrist, right? And that's how I would address it to change the outcome of every time you golf for too long, you're getting wrist pain. Does that make sense?
Yeah, that makes sense. Thank you.
I had more of like a career question, if that's okay.
Of course.
Because I'm kind of interested in like sports, like medicine as like maybe a career. Like, what did you major in to learn more about this and stuff in college? Because I'm gonna be a senior next year, so I kind of like have to make decisions soon about that.
Yeah, I love that question. So the good news is you can major in anything leading up to your graduate school. So if you decide that you want to go for bio or pre-med track, that is great, but it's not mandatory. So I actually majored in psychology. And then just when I decided to go to PT school, I took all of the prerequisites. So all of the science classes, biochemistry, all of that good stuff, so that I could apply to PT school. My biggest recommendation is to go and volunteer in different settings so that you can see a little bit more what the day-to-day of each job looks like. I spent a lot of time shadowing physician assistants, medical doctors, orthopedists, and trying to figure out, okay, how can I spend the most time with patients and how can I be the most active, right? So in my sessions, I'm jumping, I'm exercising, I'm demonstrating things all day long. That fits my lifestyle a little bit better than working in an office and having 15-minute slots where I'm going in and out and having these conversations with each patient. So I would highly recommend doing some observation hours.
Okay, thank you so much.
You're welcome. Feel free to email me also. I love to talk to students, so I can definitely talk to you on the side if you want to go into any more detail.
Okay, thanks.
Oh, okay. Yeah, I have a follow-up. I have a question actually about shin split. Like, what is the worst case it can get? It will like, if the worst split, will you have to like go through an operation or stuff? The worst case scenario.
Okay, if we're talking about shin splints, or are we talking about one of the tendon injuries, or just in general?
In general, yeah, like the worst case scenario, what will it be?
As far as these overuse syndromes, the worst case is that you aren't acknowledging what's going on in your body and you're not giving it the proper care or recovery. And if we keep going, that can cause what we covered, those partial or full tears. So it makes you more susceptible to a severe injury. And as you saw in that video, that Achilles rupture, that's a full rupture. That is definitely something that is a surgical candidate. What we want to do is identify these things early on in your training, learn to listen to your body and figure out, is this normal that I'm sore the next day? Or is this something that is true pain that I need to scale back and take a look at my training? When it comes to shin splints, usually that's not a surgical type injury. That's much more a game of, do we need to rest? Do we need to do anything else to allow that inflammatory process to calm down? Are we modifying the right pieces in the training? So scaling back the running distance, or scaling back the high intensity workouts with jumping and things like that. But we're usually not getting into the conversation of surgery.
And nice, great, thank you.
Yeah, I also have a question. So if you do get tendon or shin injuries, is there like anything that can help you recover faster? And if there is, like, what's the fastest method?
Absolutely. So the fastest method is to identify the source first. So be very honest with yourself what your training looked like over the past 2 to 3 weeks. That is the first step when I am interviewing a new patient with these complaints, is I go into very specific detail. I don't want to know how often you're working out. I want to know how often you're working out, for how long, what does that look like? Tell me exactly what exercises you're doing. Tell me what, how long you rested in between doing the next workout, and for how long have you been training consistently. So do a self audit, write down all of the exercises that you've done in the past 2 to 3 weeks, and identify, was there something that all of a sudden you added in that maybe your body wasn't ready for? And then you can remove or alter those triggers or things that will kind of stress your body a little bit too fast. I am big on learning to modify rather than resting, especially when it comes to these types of injuries, because there is usually something biomechanical, so how your body's moving, something about what you're doing that is stressing the wrong areas, versus this being an external force that is causing the issue. So you really need to identify, am I doing something in poor form with very heavy momentum, or did I all of a sudden throw an exercise in there that was too hard for my body or too hard for the level that I'm at?
Okay, that makes sense. Thank you.
You're welcome. I wish there was a, magic, if I feel this pain, do this and it'll go away. But it's a lot more work on your end. Does anyone have anything else?
Yeah, I actually have one more question. So going off of what VJ said about like how it only hurts when he trains and then it's fine when he rests. What like at that point, what should you do? Should you just go to physical therapy to get like a checkup, or is there anything I can do on my part, like icing or anything? Because I also have that sort of like pain. While only I do exercises, it hurts. But then when I rest it, it doesn't.
So if it is something very specific, like golf, right? So every time you do this one specific motion, the pain returns. Then you rest and the pain goes away. Repetitive cycle. Then I would absolutely recommend having a professional look at it and say, okay, what's going on elsewhere up the chain that could be contributing to this, right? And that's a situation of rest makes it feel better, but there has to be another cause that is leading to that, because if you're at rest and it doesn't hurt at all, then the factor is the movement, right? If you're talking about every time you work out, a different area or a different thing pops up, then that may be a little bit more of you looking at what your workout is and deciding, okay, how can I choose exercises that are giving me results, making me stronger, but not causing pain? You should have a nice soreness the next day, but it should never be true pain.
Got it. Thank you. All right. So are there any more questions from the attendees, or think we're good to go?
I have one more question.
Go ahead.
Okay, yeah. So what do you think is the most fun part of this career, like the career related, like similar to yours, or like the part where you enjoy the most?
Yeah, so my favorite part is this puzzle, what we're doing right now of this is the pain that I have. This is when it comes on. How do we backtrack and figure out the source and eliminate certain things so that we can get you back to what you want to do? I really love that puzzle piece and trial and error, figuring out, okay, well, we took this piece out and we're still getting the pain, or we improved your shoulder range of motion, but in the golf swing, you're still getting wrist pain. So layering those pieces and really teasing it out. And I think that it is so much more of a team effort of us working together throughout the process versus when you typically think about going to the doctor, you say it hurts here, and the doctor says, okay, try this. You leave, you try it, and then you come back, it didn't work, right? And that process. I get to really go through each session and go through the exercises with the person. I've had people bring their golf clubs to the office so that I can actually see, all right, well, we tried these 5 things and nothing changed. So I need to actually look at your swing. And I moved the treatment table out of the room and we went through the actual pattern. So getting to do that together is really fun. And now on video, I have, another layer of that because I'm describing the movements and I can't actually make any adjustments. I have to have very good cueing in order to get you to move the part of the body that I want you to move so that I can see what's really going on. Are any of you thinking about careers in medicine?
I am kind of. I'm still deciding.
Okay.
Yeah, maybe chiropractor or something like that around there. It's interesting. Yeah.
Yeah, like I said, the best thing you can do is volunteer in a couple different settings and really see what that person's day-to-day is like. And that's how you can tease out or narrow down the career paths. It's a lot of time and energy to invest if you don't know what you're getting into ahead of time.
Yeah, perfect.
Okay.
All right, I guess there are no more questions. Any last minute question?
You have my email, and
Yeah.
hopefully, Jason, I sent over the PowerPoint and the articles to reference. So if anyone has any questions, feel free to email me. I'm happy to talk about more detail of what we went over today, or if anyone wants to talk about their career path, I'm open to that.
Do you have any socials or like social media where we can find you?
Yes, it is House of Physical Therapy. We're on Instagram and we tend to post little exercise videos that we would give our patients, and sometimes some facts or definitions, but mostly we're sharing exercise videos. Just nice and simple. House of Physical Therapy.
Is it this in the chat? Yeah, so just House of Physical Therapy. So if you guys want to check it out, just follow that Instagram, and you can get in touch with Stephanie in the future if you guys would like. So yeah, so I guess that concludes our speaker webinar. If you don't have anything to add, right, Stephanie?
No, that's it. Thank you so much for coming today. I appreciate you being so invested in learning on a Sunday afternoon.
Perfect. Yeah, we thank you so much on the behalf of future athletes. Thank you for being such a well-spoken and professional speaker. Thank you for taking the time to even like present to us. We really appreciate your time. But yeah, so I sure learned a lot today, and I hope you guys also learned one thing about your body, or about your health. So yeah, that concludes our speaker webinar. Thank you, Stephanie, for coming. And yeah, if you guys want, message her on Instagram. And
Hope to hear from you guys.
for sure.
Take care.